so far away. From the National Institute of Environmental Health Sciences, we have Dr. Michelle Heacock. She's a program officer at NIEHS for the Superfund Research Program. This is a grant program that has a multidisciplinary approach to understanding the toxicity and risks of hazardous substances on human and environmental health. Also in her role as a collaborator with the World Health Organization, she is the focus area co-leader for the project on e-waste and children's health. She received her doctorate from Texas A&M University for work on the interplay between DNA repair proteins and telomeres. And she did a postdoc at NIEHS investigating causes and outcomes of cellular toxicity in response to DNA damaging agents. So with that, I'm very happy to turn it over to her to make a presentation on a particular class of chemical challenges.
You did very well without using notes. I'm embarrassed to say I'm going to have to use my notes so that can keep me on task as well. So first of all, thanks Josh and Ann for putting this together. It's really nice to see that hazardous substances, chemical contaminants are being included into this. So I just wanted to tell you a little bit about e-waste. This is something we see as an important, I would say emerging because it's been out there, as a global concern. I'll just kind of touch a little bit on what e-waste is, some of the problems we see associated with it, as well as some of the strategies that we're trying to take through our e-waste network to try to reduce exposures. So e-waste starts off with anything that you plug into the wall. So things you probably have at home, washing machines, dryers, probably things that I see you have right now, your computers, your smartphones. Anything that's plugged in is how e-waste starts off. It's one of the fastest growing streams, global waste streams. It's predicted that by 2017 that the amount of e-waste will be 65.4 million tons. Just to give you an idea of how fast that's increasing, that's about a third higher than 2012 levels. So while e-waste, I'll share with you some of the hazardous substances that are contained within the e-waste. The thing that's driving the recycling are valuable things such as copper. So where is all this recycling taking place? Much of the e-waste heads, so discarded electronic equipment, heads to low to middle income countries. China and countries within Africa are the biggest recipients of e-waste. And China produces 6.6 million tons of e-waste per year, second only to, which is not surprising, the United States, which produces 7 million tons per year. And so why do we ship it? It just simply costs less to ship it than to deal with the recycling here and I guess at home and domestically. So unfortunately, much of the electronics recycling that occurs is what's termed as informal recycling or primitive recycling. This is what's happening right now in developing countries, low to middle income countries, and they're doing this to harvest those valuable materials such as copper. And the majority of the workers that are recycling, it's similar to what we heard from Fredovic, is they're usually poor, they're migrant workers, and they're not concerned for their health. And as you heard from Dr. Birnbaum's introduction, she said a lot of times people don't appreciate the ramifications of being exposed because the window from exposure to ill health effects, it's got a big time window. So here I'm just showing you some of the exposure routes for e-waste. So on the top left, what you see is the very common practice of burning. So what's going on there in a styrofoam bin, so we're even getting more hazardous substances, is they're burning the wires to extract the copper because it's really fast. Another unfortunate commodity or a commonality in e-waste recycling is children are often involved in recycling. So this could be simply because they're recycling themselves. They got little fingers. You think of these little circuit boards. They're able to take apart things much easier. Also, these are migrant workers. Families are working at sites, so children are playing. And obviously, because they're because they're children, their exposures are a little bit more worrisome simply because of their physiology. So they get more dose than we would. They can't handle the toxicity. Their systems aren't as developed as ours is. So the bottom left, the bottom left is another exposure route. And here what you see is just, you can imagine that burning these wires is going to produce a lot of dust. These people are just walking through with food, so the dust is blowing on the food. It's very common for a lot of these sites to be close to things like food markets. So dust is another source of exposure. And then here on the bottom right is why we're here today is, as you mentioned, a lot of times people just might be washing their equipment near the water, or it simply happens that any waste recycling site is near water, or it is seeping through the sediment ultimately into the water stream. So exposures aren't limited to just recyclers. It's affecting nearby communities. It's affecting, in fact, studies have shown that the contaminants found in e-waste have actually been found in waterfowl and fish hundreds of kilometers from the e-waste site. So it's traveling. So those people who think it might be confined to that site, it actually is moving. So here are some of the hazardous substances that are found in e-waste. And this is just a sampling of some of those. And so Josh has asked me to concentrate on the organics. So on the bottom are some of the organics that you see. PCBs are present in some of the condensers, transformers, often released as a combustion byproduct. Brominated flame retardants, these are in the plastics, printed circuit boards. PAHs, again, released as a combustion byproduct. And all of these sources can be found, all of these hazardous substances can be found in air, dust, soil, water, and food. Here, this is important on this right, these are the known health effects for the single constituents. I should point out, Frederick also said that there's limited studies done on these kinds of things just because of the effects. So there's a handful of studies. In fact, Dr. Birnbaum is an e-waste researcher. She does have a study in Vietnam. But we know that lead causes damage to the nervous system. We know that brominated flame retardants can lead to adverse thyroid effects. What we don't know is what happens when you're exposed to all of these at the same time, even through different routes. So we can only imagine that there's a good possibility that it's worse. So the good news is that even though we have all these bad things in recycling, it's potentially, it's mining, it's sustainable. And the reason that is that electronics are rich in sources such as copper, aluminum, gold, silver, palladium. These can be recovered. The trick is to recover them safely. And in fact, studies have shown this study here on the right, or these numbers on the right, come out of the Global E-Waste Monitor based on 2012 e-waste estimates, show that if all the gold was extracted properly, you could recover 300 tons of gold. And so here, I'm just, if you just take a closer look at what's happening to some of these hazardous substances that are seeping in the environment. So this is just, I just pulled together a few studies that were taken out of samples from South China at some of the e-waste sites. And what you're seeing is these numbers that I'm reporting are just the fold increases of a particular constituent, so lead or dioxins or flame retardants over a reference site that's not an e-waste site. And you can see that in the air, the lead is 2.5-fold higher at an e-waste site versus another site. You can see that the wastewater is 120 times higher than even mining site waters in China. The flame retardants, you can see the sediment at burning sites, it's up to 444 higher in e-waste sites. So a couple of points here is to show you that even if the recycling is done properly, you still have that problem of the legacy of the contamination. So Josh, when he introduced me, he mentioned I was from the Superfund Research Program, and similar to the program I think you're involved with, Frederick, is it's an interdisciplinary program, and we think a lot about how do exposures, are they first of all bioavailable? So just because you have them in the environment, are we actually taking them up into our bodies, and is it causing toxicity? And so here what I want to point out is that indeed, a lot of these constituents, hazardous substances and e-waste, are being taken up. And we can see that by looking at fish. And we can see that in some cases, this diagram is showing you that dioxins and PCBs can actually bioaccumulate as it moves up to the food chain. So thinking about water, if we're eating the fish that ate the plankton, that ate, you can imagine that that fish has a much higher concentration. So that would be a reason why you want to care about e-waste. So I would be remiss if I stood up here as part of, in addition, Josh mentioned, how are we doing on time? Good. I am also one of the co-leads for a WHO NIHS collaborating center, and the focus area that I'm involved with is e-waste. And so what I wanted to tell you a little bit about is some of the steps that we're taking as part of this collaboration, and what the main crux of it is a network that's been formed. How it started was we had a meeting at the WHO that convened experts, so running the gamut of stakeholders, so human, environmental health specialists, occupational health specialists, secretariat to the Basel Convention, International Telecommunications Unit, all got together and sort of evaluated sort of what's known about the health effects of e-waste. Is it a problem? And just as Frederick said, I work with a Federico too, so I might mess up your name, I apologize. But it was, see, now I totally lost my train of thought. So we got together, evaluated the studies, as you said, I've got the back, there's limited studies, but what they did say was, hey, you know what, we do know there were studies that measured in breast milk, in blood samples, in urine samples, that people who were working at e-waste sites indeed were exposed to these hazardous substances. And it was, let's get together, what can we do? We decided that the thing that we can work on right here, right now, just knowing that there's international initiatives going on, there's initiatives that are working with the computer manufacturers, electronic manufacturers, design electronics with recovery in mind. That's great. So, but the fact remains is that this is still going on. There's a lot of informal recycling. So what we decided to do was, what can we do to start to prevent and maybe intervene in these exposures to reduce the exposures until all of this kind of comes into place and recycling is done in a more formal manner. So how we did that was we released a commentary, environmental health perspective, sort of outlining what we had in mind. And then we also followed up with a workshop that was connected with the Pacific Basin Consortium, which is also an interdisciplinary organization. And what we did is we convened e-waste researchers sort of from across the globe. And so what I wanted to share with you was just a couple of case studies, small case studies. We looked at this sort of what was going on, what were some prevention interventions that were going on in Uruguay, Ghana, and we also looked at a case study in the Philippines. And I show you these just to kind of demonstrate the fact that although this recycling, it's all common, it's informal recycling, the situation can differ wildly. In this case, what this was just outside of Montevideo in Uruguay, is they found out that there was, children had high blood levels, and what they pinpointed it to was this e-waste, this former e-waste site where the soil was still contaminated. And what they did was simply, as a small pilot project, it was a small plot of land, they were actually able just to kind of take that soil and get rid of it. And what they found was before and after, they measured the lead levels in the soil as well as in the children, and then they found that they were actually able to reduce the lead levels in the soil, and the lead levels in the children's blood was also reduced. So this is an example of sort of a small, yes, we can do something. If it's a small site, we can get rid of it. The second one is, this is probably the most well-known e-waste site. If you hear about e-waste, you're going to hear about the Agboboshi site that's in Accra, Ghana. And what I wanted to share with you in this workshop was we had the researchers who were working very closely with the community. They had been working with this community for over 7 years. And then we also had representatives from Pure Earth, which is formerly Blacksmith Institute. And what I wanted to share with you was that during the workshop, we had the Blacksmith Institute representatives saying, hey, we wanted to make this difference, so we got a wire stripping machine. They found out that wire stripping machine was the gauge was bigger than what was useful for the workers. So they found, okay, we actually have to go in and talk to these people and find out what their needs are. And they were able to find wire stripping machines that are at a gauge that's it's more reasonable for the workers to use. And they also shared with us, there's one of the things we really needed to do was get their boots on the ground and talk to the community and really get their trust, because they come in saying, hey, we want to make this difference, but the workers are reluctant. On the right, I just wanted to share with you, just in thinking about networking and what can we do, this is a group who are that's part of the GeoHealth group out of NIH, out of the Forgery group, and I serve as one of their, I'm their US project collaborator. And so what they're doing right now is they've done a lot of that boots on the ground, working with the community, identifying their needs, sort of gaining their trust, and they're involving the workers on planning the interventions. They're also working with, because there's Anglophone, so there's English and French countries, they're actually working with some of the adjacent countries to try to build capacity to be able to get what they need to start to reduce these exposures. This is a work in progress. We're just getting started on the study, but I wanted to share with you, hey, there's some things being done. The last thing I wanted to share with you is, so here I've shared the little site in Uruguay, the huge site in Accra, Ghana. Here's a site that was just outside of Manila, or just in Manila, Philippines. This one differs because these e-waste is being recycled informally, often in homes, because it's in a city. So here, again, I point out the big difference is that it was doctors of medicine of the world, doctors of the world, sorry, and they knew that they had to knock on those doors and sort of gain the trust of these people. They wanted to start to reduce their exposures because they discovered that these people really had a mistrust for public services. So once they started to do that, they were actually able to start to do some intervening, and what they were able to do was simply bring things like personal protective equipment so that people aren't using their bare hands and they're and masks, so they're not breathing in those dust particles or those fumes from recycling e-waste. And they also, I just share with you, recognizing they had to do some targeted communication. So here, they recognized a lot of the workers, the children were boys. So it was just sort of kind of getting, the e-boy, the electronic boy, just to kind of appeal to them so that the boys who were recycling could actually understand sort of in a simple way, here's what you need to do to protect yourself from e-waste exposures. I'm waiting for her to stop here. And so here, why should you guys consider e-waste? The contaminants are found in water. I hope I've convinced you of that. They're found in waterfowl and fish more than 100 kilometers from an e-waste site, so it is traveling. Also, just to say, there's known, what's coming more and more through research is there's known exacerbation of effects of co-exposure, so exposure to a contaminant and exposure to an infectious agent. And one example of that is exposure to arsenic and Pseudomonas. You actually get an exacerbation of pneumonia when you're exposed to both those things. And then what I shared with you at the beginning is just to say that, stop. I'm pretty bad. So informal e-waste recycling is just increasing. So I'll just skip over that and just say that we're continuing with the network. We plan to keep building capacity. We have hopefully we're planning a workshop that gets approved for next year. But with that, just kind of present some acknowledgements. William Sook is my supervisor. He's the lead for the Superfund research program. I work very closely with Marie Noel at the World Health Organization on e-waste. And then these are just these folks, it's important to mention, they were just so honest and forthright during this workshop that I shared the sort of the main points with you. Just saying, hey, you know what, this worked really well for us and this didn't work. And so that was really nice just to try to get this network sharing idea so that they could hopefully reduce more exposures.